We begin our show today with a look at the return of measles. It's not really prevalent here in Niagara Region, but we are seeing cases in Ontario, as many as 7 cases right now. Quebec has been hit hard by the return of the disease. And in the United States, up to 17 states are reporting cases of the measles. Dr. Atiba Nelson is with us. What is the reason behind this resurgence?
The reason behind this resurgence is unvaccinated travelers traveling to international destinations, being exposed abroad, and then returning to Canada. That's what we're seeing provincially with the cases that you mentioned earlier.
We were at a stage, I think what I heard was somewhere around 1998, 1999, where really in Ontario we had eradicated measles almost completely.
Correct. The issue is that other places in the world didn't have as much success with eradicating measles as us. Therefore, when people travel abroad and are exposed, if they're unvaccinated or undervaccinated and come back, they could be exposed to measles and then develop measles.
A stat that I looked at was that between 2022 and today, 79% increase globally. I might have that number wrong, but that's kind of alarming when you think of that kind of an exponential increase.
It's a large number. However, if we bring it back to Niagara Region, most of our residents are vaccinated. We are well over 90% vaccination rates in Niagara. So we've sort of built a firewall around Niagara Region in terms of people being vaccinated against measles.
But people from Niagara do travel, and if they are unvaccinated, and especially unvaccinated children, and I think that's part of what's happened since the pandemic is that people lost track of those other vaccinations.
Correct. So we saw in the pandemic that people may not have presented to their family doctors to receive their vaccinations. Therefore, there might be a few people who are unvaccinated or undervaccinated. What we ask those people to do is check their vaccine records, and if they are not up to date, go to their family doctor, go to their nurse practitioner, go to a walk-in clinic and receive those precious, safe, and effective vaccinations.
Typically, people get vaccinated at what age?
So typically, your first vaccinations of measles-containing vaccine is at 12 months of age, and then we require you to get another one at between 4 to 6 years old, just before you get into grade 1.
Now, the first one is called an MMR vaccine, measles, mumps, and rubella. The other one includes something else. What is that?
Correct. So the first one is an MMR, measles, mumps, rubella, and then the second one includes varicella as well. So it's MMRV.
Schools help out in some way, Dr. Nelson, because schools require people to present a vaccination record for their children.
So there's something in Ontario called ISPA, which is the Immunization of Schools Pupils Act. It's an act that requires anyone attending public or private school to present their vaccinations or receive an exemption to being vaccinated. So schools help out in that they require people to be vaccinated, and public health collects those records. What your viewers might be experiencing is receiving letters from their friendly neighborhood public health department asking them to complete one of the options, whether it be present their vaccination records or receive an exemption.
Is right now around the time when those letters go out, am I right?
Correct, yeah. So a lot of your viewers, a lot of Niagara Region residents have received those letters from us, and what we'll be doing is asking them to present vaccination records to us and or going to receive vaccinations if they haven't. There's also a few other options they can take.
Does public health have an idea on whether or not those numbers are a bit higher than they were in the past?
Yeah, what we're seeing is that the numbers have stayed steady. People are generally vaccinated in Niagara Region. Those who aren't usually face barriers to getting vaccinated, such as their doctor's not open at a certain time, or they just don't know where they are on the schedule. If we have newcomers who were vaccinated in another country, they may have been vaccinated on a different schedule, and they're just unsure of what they should be doing. But anybody can call Niagara Region Public Health or go on our website and receive information from us. Our public health nurses in our Vaccine Preventable Diseases department would be glad to talk to you about what your options are.
So if I'm someone who's very far removed from being a grade 1 student myself and can't remember where my vaccination record is, I could call public health?
Yeah, you could call public health, or you can go into your family doctor. If you've had your family doctor for a long time, they probably have a record of the vaccines they've given you, and that could be your first option to find out what your vaccine status is.
How does someone go about getting the vaccination?
Yeah, so there are a few options. Like I said, you can go to your family doctor, your nurse practitioner, or walk-in doctor. And then public health is holding clinics for school-age kids who receive letters from ISPA to be vaccinated.
Does the region have some information on the website about all of this?
Of course. Viewers, residents can go on our website at niagararegion.ca/health and get information about vaccines, especially measles, and how they can get vaccinated and options. You can even call in and our wonderful nurses will be able to help you.
Very important to look into this for everybody. Dr. Nelson, thanks for coming in.
And thanks for having me today. I really appreciate it.